We've all heard this saying, I'm with the government and I'm here to help. Well, the mayor of Detroit just declined over 6,000 doses of the J&J vaccine, stating that Pfizer and Moderna were better. I'm Michelle Lynham, MD, Dr. United States of America. I am so thrilled that there is a third vaccine with EUA. But I hear a lot of people not so much debating whether or not they're going to get vaccinated, but instead they're now debating which brand should they choose. Unlike Pfizer and Moderna, which are messenger RNA vaccines, the J&J vaccine is a viral vector vaccine, as is the AstraZeneca vaccine, which we are watching. It's not out yet. A harmless virus is used as a delivery system for the genetic data of the SARS-CoV-2. Older vaccine technology we've been familiar with is things like polio, which is inactivated virus. For COVID, those candidates are Sinovac and Sinopharma. Another older technology is live attenuated vaccine, which is MMR, or the chickenpox. For COVID, they're working on Codagenics, and an Indian company has one. Novavax is also coming, and that uses the newer technology of recombinant subunits, which I'm really excited about because that's what I did my research on at MIT. For the J&J trial, there were 45,000 people enrolled. There was 72% efficacy in the USA and 64% efficacy in South Africa. There was 82% efficacy against severe disease. The study also gave us data that showed it limited asymptomatic disease as well, something that was lacking in the initial data from Pfizer and Moderna. J&J is also looking at efficacy rates if they give 2 shots. But you cannot get hung up on all these numbers. All these vaccines are great. Remember, each study had different designs. Also, the more recent trials are having to contend with the more contagious variants. The J&J vaccine has some serious advantages. Logistically, it can be stored for 3 months at normal refrigeration temperature. The efficacy was excellent after just 1 dose, and that means it's going to be great for patients who are often lost to follow-up or hard to schedule for a second dose, like the homeless or people who are traveling. J&J had milder side effects. There was no anaphylaxis seen in the study, but remember, the mRNA vaccines did not see anaphylaxis until it rolled out to the general public. But the number one thing that all these vaccines share is that they're 100% efficacious in the trials from preventing death. That is really our ultimate goal. You can't compare one vaccine to another because the trials are different. Remember, Pfizer and Moderna were done during the plateau of the summer, whereas J&J had to contend with a huge peak in December and those new variants. So which vaccine should you get? Any one that you can get. Don't turn down an opportunity. I thank you all for following me on Facebook as Dr. United States of America and on Instagram as Dr. Model Mom. Take care. Be safe.